Hi, I'm Dr. Ford Gatgens with Accent Smile Center. Today we're going to talk a little bit about bite issues, okay? And we've invested in some excellent technology that's can help in those situations. You know, a lot of times patients come in and see us and they have very sensitive teeth, or they may have had some restorations done in the past that are having problems, or they may have broken tooth or restorations. And so I'm going to talk about the Tekscan. The Tekscan actually is a digital device that allows us to measure the bite forces as well as the timing on our teeth. And that's really important because all of our teeth work together kind of like a team, and a lot of times somebody may come in to see us and they may have a specific area where they're having discomfort in. And what I've found in the past is if I am kind of narrow focused and only look at that specific tooth or that specific area, I might miss the bigger picture as to why a tooth may have broken or why some issues may be presenting with the patient. So this Tekscan device allows us to digitally measure all the bite forces of the teeth as well as the timing, and that's really important because it does allow us to see what's going on from the big picture scale. The three important aspects of our chewing function are the TMJ, your temporomandibular joint, the teeth, and then all the muscles that allow things to function. And so we really try to look at all those things and assess all those things when we're trying to properly evaluate a situation that somebody may come in. So the actual scan. So when we utilize this technology, the Tekscan, we do three measurements. One, we do a multi-bite, which just has the patient bite down in their regular centric motion on their back teeth, hold for a second, and then open. So this shows the actual mapping of the bite forces in 2 dimensions, and then also we're able to see it in 3 dimensions over here. And right down here, the timing measured in seconds, and then also the total maximum force from 0 to 100 is recorded. The A line down here in the recording, I'm going to reverse this recording back here, is when the teeth first start to touch. The B line is the maximum intercuspation position, which simply means when all the teeth are touching maximally in the mouth. The B to C line is just when I'm having the patient hold down and clench. And then the C to D line here is when a patient actually is opening, and after D the teeth are no longer touching. So we do a multi-bite first so that we can make sure that we're getting a repeatable position when the patient closes. So I'm just going to kind of show this video and scroll along here. And what we can see early on is that the patient has a lot of force on the left side and some early premature contacts. Again, this little guy right here that looks like a red and white kite is called the center of force, and so the center of force is pretty drastically off in this patient to the left side, and you can see with the bite force being 67 to 32% here. As the patient continues to close down, you can see that the center of force moves towards the midline, and also the patient is finally able to get some contacts on the right side over here. Now, as far as the force goes, we can see that the patient has very heavy loading on the back molars on both sides. The patient came in and was having some discomfort on the upper left side of the mouth, and so this really gives us some insight that's really important as to understanding what's going on. I also mentioned that the patient did have a fractured porcelain crown as well, and was having some open contact issues here. The second bite that we do is a right lateral or left lateral, and here this was a right lateral bite. Again, A to B, we see the movie playing out very similar to when we took the multiple bite forces. And again, what we're looking for here is when the patient slides her lower jaw to the side to see if there's any teeth in the back that have any interferences. Again, seeing the same thing on the left side here as we have the patient close down and clench. When the patient tries to start moving the jaw to the left side, we're able to see something really significant, and it's a big indication of why she's having pain on this left side. We're able to see the center of the force that's going right towards these back teeth. Ideally, we want the front teeth to guide the back teeth, not the reverse situation, but right here we can see clearly that she has back teeth that are interfering with her jaw ability to move properly, and anytime we see the center of force that's going perpendicular like this to the midline, can very well be assured that usually the patient's going to have some symptoms, pain, discomfort, hypersensitivity, etc. So those are the 3 bites that we take with the Tekscan, and then from that we can actually transfer this information to the mouth, and we're able to see very specifically what the markings on the teeth mean, and it also gives us big insight into the timing of the teeth. So again, it's really important when we're looking at the teeth to look at all the teeth together, because they all function together with the jaw joints and the muscles, and a lot of times it's very easy to be focused on where a problem area may be, and we may be missing the real gist of why something is breaking down, or why a tooth is broken, or a crown is fractured, or they're having hypersensitivity. So this technology is great. We're able to really do some comprehensive planning and make sure that whether it's natural teeth, fillings, or other restorations that are placed in the patient's mouth, that they're going to last and function ideally as long as they can. And when I'm talking to patients, if you think about this being similar to your vehicle, if I go and have my tires balanced and rotated and have some new tires put on, and I'm driving down the road and I'm still noticing the same issues that I had prior, maybe an alignment needs to be done on the vehicle. The mouth is the same way. A lot of times when we start to wear down our teeth over periods of time, whether it's from natural wear, whether it's from excessive wear, clenching, gritting, grinding, or parafunction, that changes things. And so it's hard to go in and restore tooth by tooth in dentistry without looking at how all the teeth fit together. And so really this allows us to go in and look at aligning the teeth and the bite properly for our patients. So hope that helps give you some insight into the Tekscan and the technology that we can use to help with various things such as hypersensitivity, tenderness, soreness. Recession areas are big areas that we're able to treat as well. So thanks so much. Look forward to hearing from you.